All right, let's take a couple phone calls. 219-845-1100. You want to talk to Dr. Mary Tilak. She's in both Highland and Cherville. Hey, you're on the air. What's your name?
Hi, this is Jean. Dr. Tilak's been my doctor for years since she first came to the area. And she was the first doctor I found that I didn't feel like I was livestock going through a gate being treated. But my question to her right now is, do you think that will, like with the outcome, is it going to cause doctors to cherry pick clients that are going to be more favorable for their outcomes, and how are they going to deal with that? And I'll hang up and listen.
What a great question.
Thank you for your encouraging words. It means a lot to me when I hear from my patients about their experience, and I enjoy every moment of it. Yes, you bring in a very important point. This discussion does happen among physicians in their desperate moments, but I do not think we will be able to cherry pick our patients. Let's look at it two ways. When it comes to federal government Medicare insurance, I believe it'll be that we will be allocated certain number of patients, groups of patients. How it's going to happen, we still do not know. And there will be factors in this metrics that would be kind of added to each of the patients' numbers based upon their last years of healthcare expenditure and their health factors. So they know they've been tracking this. And there are also areas, certain geographic locations where you have more complex medical situations and more worse socioeconomic conditions who need a different type of metric. So all of this is being looked at, this has been an extensive effort among policymakers. So they are doing their job. And I only wish that we will take the political ramification out of it and just focus on how much of complexity already exists in this.
Yeah, but you see, I'm looking at this, and I know that you're working on your MBA, or you're working.
Yes, I am.
Yeah, you're working on your MBA. Obviously highly educated, and you embrace technology. 2 or 3 times, she's always on her phone. She's always connected. But medicine doesn't. I mean, isn't based on. You're not the norm. Maybe the younger doctors and so forth. There's a lot of doctors over, say, 35 years old that have to be resisting the metrics, that have to be resisting outcome-based coverage, or getting paid
Absolutely.
for. They have to be resisting the technology.
Yes. Yes, there is resistance. There will be resistance in any change, no matter what it is. But those who resist such change should find a different job because we need to change. I'm telling you that the way the healthcare system is now is cannot be sustained. Number two, why shouldn't we track metrics and improve quality of care? That improves patients' experience, and I think that is the most important part of. In every other industry, it is consumer based, isn't it?
Yeah.
So
I mean, you
what
think
about
about it, you
this?
buy a car, you want to buy the best car. If it doesn't work out, you take it back, or you don't buy it again. But you're right in terms of healthcare. I mean, even it goes as far as people don't even check prices.
That's my point. So the culture in the medical industry has to change. It's not going to be an easy change for us physicians. You're very correct. You're right on the mark. Physicians who are older, who've been in this system for so long, don't find it right to become a patient centric healthcare delivery system. It has been a provider centric healthcare delivery system so far, but it has to change. And it is changing, and this change is there to stay. So whether you want to change your culture and navigate this landscape, or you want to change over and go to some other field completely, it's your choice.
Healthcare cost. So, in your method that you're talking about, and which is evidently is kind of was one of the directions that we're headed, where you're talking about basically mapping out everybody's all of the factors that go into them, and they're in a program, and that is all accessible. Okay,
Hmm.
you're talking about a situation where they come to the doctor, or let's just use me. Okay, and
Okay.
I'll be honest with you. I come to the doctor first couple times, and she's given me this long ass lecture about you have to take care of your own. Uh, it's more of almost like a self image of, are you someone who wants to control your health care, and you want to be healthy, and you want to have a good outcome. then you have to engage in that and you have to do X, X, and X. And I'm like, listen, I'm just a guy who drinks beer and eats pizza and plays basketball once in a while. And then I'm having all this trouble in my stomach. And it's like, all right, well, none of this is going to change unless you engage in the process. Now, I've engaged in the process. I'm much better off on it, less medication, and so forth. So if I were to, in that first, say, year I'm seeing you, I'm not going to get in, I'm going to be penalized in some respect because I'm not doing the things that I should be doing and I'm not getting any better. And so why should everybody else have to pay for me? I should have to pay for that problem that I'm choosing, correct?
No, that's what you're doing now. I told you that 80% of the healthcare cost is driven by 20% of the population.
And much of that population is like me for that year, not getting the message.
Yes, so 20%, that's what you're doing now. So don't think that the change is what is going to make you do that. You have to understand where you are now in healthcare delivery.
Okay, but my point is that so I do make the change.
Yes.
Start eating better. I'm not drinking as much beer and so forth. So there should be some economic incentive for me,
Absolutely.
but there's not now.
Yes, that is the change that they're trying to bring in. So if your employers are trying to bring in the same system, insurance companies are trying to bring in the same system as to saying, okay, if you make these lifestyle changes and you're improving every year, your health risk is assessed and you will have a reduction in your premiums.
Let's talk to Lori. Hi, Lori. How are you?
Hi, Ted. Good morning. Hi, Dr. Tilak.
Good morning.
I just wanted to say thank you for taking good care of my neighbor. I referred him to your office, and I actually gave Jed's name, but I know Jed was thinking, I don't know who this person is, but I know that if, Jed trusts you being his physician, my neighbor is in good hands. And I can tell already by all the tests that you have run, he's quite elderly, over 70, and he's on quite a lot of medication now, which was a big difference from when he was going to the U.S. Steel Clinic. They did very little blood work and just kind of gave him his blood pressure medicine and sent him on his way. So I know being involved in medical billing, I can tell that you've been taking really good care of him, and I just wanted to thank you.
Well, thank you very much.
Thanks a lot, Lori. What do you say to that?
I really appreciate these comments because in healthcare, as a physician, it is we're talking a lot about the complexities of it, but more importantly to me, it is how I can make my patient's experience better. How can I improve the quality of this patient's life? Somebody who has trust me. So it is a relationship that I build with my patients that I want to have for the rest of my life and their lives. So I believe that this is the best reimbursement that I can get ever in my life.
219-845-1100. Last phone call. Hey, Carl.
Morning.
Good morning.
Yeah, one more of those payments you were just talking about, Doctor. Yeah, I've never met you, but you've impacted my family in a profound way. My father-in-law was a World War II and Korea vet, very grizzled man. You helped convince him to get some testing done, which just kind of verified that he was in the end of his life. Because of your diagnosis and assistance, he was able to get into hospice. He passed shortly thereafter. But I think that the most touching part of the whole scenario was the fact that there was a beautiful floral arrangement sent by you to his wake. Thank you, Doctor.
Oh, thank you very much. Yes, I enjoyed every minute I had to be involved in his healthcare. It was a very short period. I always wished that I knew him earlier. And I remember the last sentence he told me before he died. I held his hands and I said to him, I am sorry I'm not able to help you any further, but I promise I will keep you comfortable. And he told me, you did the best that has been ever done to me. And I think that will stay with me forever. I know who you're talking about. Thank you again.
We're talking to Dr. Mary Tilak, and that's kind of odd. All these people calling in and saying thank you to a doctor. That doesn't happen every day. Doctor, just in general, though, people are, I can tell you this, they're very confused, and perhaps you've given more healthcare hope in the last half hour than they may have heard in all of the debate. I mean, what should your average person be doing right now about their healthcare?
That's a great question, Jed, and I would love to support the community in this effort. I just want you to think about yourself and your family. How can you make your family healthier and stronger in this change. I think that health is your accountability, your responsibility, and how the healthcare changes is something that you can't do much about. But if you get healthier in this environment, you're going to reap the benefits of it. Your family is going to reap the benefits of it. So think about your lifestyle. Think about exercising. Think about eating better, spending some time in meal planning, and just thinking positive. In any situation that you have, stressful situation or otherwise, think what can be done positively for that situation that you can make a difference. And I wish you all the luck. And anytime you want to talk to me,
There it
feel
is.
free.
What's the number at your? You don't even know the number at
I
your
know my
office.
number,
No, you don't.
219. It's 219-922-8051. And I hope to be on the air with Jed a little bit more. I'm enjoying this part of it. And I think we got to do a little bit more, Jed, especially with the change in the healthcare. I want to talk to the people. I want to see how we can support this
You're
change.
right. Right now, it's there's so much confusion, and you're offering hope. So we appreciate that.